Assalamu alaikum.
Walaikum Assalam.
So basically our topic is breast cancer, and we are Team Cancer Crusaders, and we are here to spread awareness related to breast cancer. So we are here to ask some questions from Sir Khaliq, and our first question is that what do you know about male breast cancer?
Basically, as most of the people, especially in the developing world, usually consider it that it is a disease that is usually found in the women. But recently, a few studies have shown us that it is also getting a common problem in the men also.
So sir, have you ever discussed the topic of breast cancer in men with your friends or family?
Not necessarily with my family. Rather, I have once discussed this topic with the doctor, our family doctor. I have asked him that if this problem exists in women, is it possible that it can be developed in the men? So he told me that yes, it is quite a developing disease in men. Specifically, he gave some references from the American Cancer Society that according to his estimate, the society's estimates, there were about 2,800 cancer patients, that male cancer patients, that will be diagnosed in 2023. So I have a brief introduction about this disease.
So sir, do you believe there is enough information available to men about breast health and the risk of breast cancer?
I'm sorry that there is not enough information. As per my opinion, as per my perspective, more than 95% people, especially belonging to the developing world, they don't even know about this disease in men. So most of the time this disease is associated with the females only. So as per the initial estimates, are my general perception that more than 95% people don't have any thinking about this disease. So talking about the developed world or the developed north, in which the developed countries come in the list, so we can say that they have adopted this disease, that they wanted to get rid of this disease, and there is enough research that is going on in America and other northern countries on this disease. But unfortunately, in the developing world, like the poor nations, they are as they are quite illiterate and the literacy rate is not very good, so people are unaware about this disease that is spreading in the developing world is also.
So sir, what do you think that could be done to improve awareness and education about male breast cancer in our local community?
Definitely it will be a great service for the humanity. Basically, as we know that the developing countries, the people belonging to developing countries are unaware about this disease. So we have to make a comprehensive efforts in order to spread awareness among the local community. For that purpose, different platforms can be used. For example, schools, colleges and universities can be used. Over there can be arranged certain seminars on this developing disease. Similarly, the district health authorities need also to have a general awareness campaigns in which they can have streamers, billboards, in which the people will be taught that this disease is getting common in the men also. So combined efforts not only from the health authorities but also from the teachers and the professors and the people who are working at some public places, so they also need to take initiative. Most importantly, the government authorities, like if we talk about the national health authorities or the national ministers who are basically spearheading the health portfolio, they need to be quite conscious, and they need to have joint efforts and joint campaigns all around the country if we talk about Pakistan. So a joint effort, a combined effort, or a consolidated effort is a need of the time, so that we need to have research, so that our health professionals need to have a common thinking and understanding and awareness, so they can transmit all these information to the common people and let them know about this impending disease.
So sir, are there any specific challenges or barriers that men in our area might face when it comes to assessing healthcare or discussing sensitive health topics like breast health?
Yes, there is quite a big room, specifically if we talk about Pakistan. As we know that there are a lot of social taboos that are present in Pakistan, as we are quite an illiterate society. You can say that, as I told you earlier, that 95% of the Pakistani definitely will not know about this disease. So the spread of awareness to let them know about this disease is quite a good thing to do in Pakistan right now. Basically, to fight different social taboos, including this actually the disease, sometimes people actually hesitate to discuss it not only with their families but also with the health professionals, just because of certain social complications or social pressures from the different groups or even their friends and family. And sometimes it become a word of the mouth that basically that person is diagnosed with a male breast cancer. So I think the most important thing is to spread awareness and to make people comfort feel while discussing such topics, not only just the male breast cancer but also the other things that need to be discussed in the family. A lot of actually the problem or health complications can be dealt with the different जो है वो डिस्कशंस की जा सकती हैं डिफरेंट फैमिली मेम्बर्स के साथ, डिफरेंट जो है वो आपके डॉक्टर्स के साथ, इवन जो आपकी जो एजुकेटेड क्लास है उनके साथ जो है इसको डिस्कस किया जा सकता है. सो दैट विल बी अ ग्रेट सर्विस.
Sir, if you could share any one piece of advice or information about male breast cancer with other in our community, what would it be?
The most important advice from my side is just to have a speak, just to speak. And if the people can speak, if the people speak about certain problems, definitely their solutions can be attained. So the people need to speak, the people need to discuss, the people need to talk about these common issues or certain health issues that specifically we are right now talking about the male breast cancer. So the most important advice is to have a say about this, not only with your family but always not hesitate to talk it with your family doctors as well as other health professionals. So this would be a great service to the humanity.
Thank you, sir.